Hey, hi, welcome everybody to the February 14th, 2024 Educating and Empowering Youth program. My name is Sarah Clute-Bain. I am the Boone County Hospital Foundation Director. So pleased today to share with you the program that is going to be all about heart health with cardiac rehab. But first, just a couple of quick notes. For those on our call today, if you could mute and turn off cameras, that would sure be appreciated. And just to let you know too that the foundation is sponsoring this program. We have another program coming up next month on March 19th. We will have Michael Brandhorst from our pharmacy department talking about education and awareness of antibiotic use, which I think will be really fascinating and interesting. So please plan to join us back next month. And then in April, the big announcement is that we are going to be back in person at the hospital. I don't have the topic selected yet, but we will be back in person and we will still provide the recordings of the WebEx out to, just the normal process of what we've been doing since the pandemic. But we also have had several requests to go back in person live. So we are going to do that. So be watching for information about that. So those are my couple of quick updates. I just am super thrilled to have, again, Cardiac Rehab here today, talking all about heart smart wellness with cardiac rehab. So we have three presenters today. So I'm going to ask each of them, which they already know this, to introduce themselves a little bit more in depth. But Kendle Demery, you are a nurse here for Cardiac Rehab. Emily Sackett is also a nurse. And then Brandon Jensen is our exercise specialist with Cardiac Rehab. So if each of you would take a moment, introduce yourselves to us and get us started in our program, I'll turn it over to you, Kendle.
Thanks, Sarah. I'm Kendle Demery, and like Sarah said, I'm one of the nurses that works down here in Cardiac Rehab. I've been here in the Cardiac Rehab department at the Boone County Hospital since November of last year, I believe. Yep, that's when I started, a little over a year. I've been a nurse since 2011. Most of my work has been in the intensive care unit, but when my family and I moved back home to Boone a few summers ago, I took the opportunity to take this job in cardiac rehab, which has been really great. And I've loved working with our patients one-on-one and learning about everybody a little bit more in depth and being able to help them on their journeys to better health and wellness.
I'm Emily. I'm also one of the nurses down in cardiac rehab, and I have been in healthcare for probably 10 years now. Most of it dealing something with the heart. I worked on telemetry floors in various roles. Now I'm down in cardiac rehab. I've been here since August of last year, so I'm fairly new, but it's taken off and we're enjoying it.
And I'm Brandon. I'm an exercise specialist. I've been here, pushing 4 years now. So, exercise specialist, straight out of college, came here. Just great time starting here and helping build the program here.
Great, thank you for that. So go ahead and dive in today. Share with us what you guys have to share about about your message today. But also, I just really quick want to say, if people have questions, feel free to pop them into the chat. Otherwise, I'll be taking notes, and we'll do my best to kind of identify some questions that we might have at the end of the program. So go ahead and take it away.
All right, I think I'm unmuted now. So the big things that we're going to talk about today are just heart health in general, different things about heredity that we know and genetics, which isn't a lot, but we do have some points on that we can touch on. We're also going to talk about maintenance for people that have had heart diseases and other types of prevention that people can do, as well as our program in general and what people could expect if they came to the cardiac rehab department and participated in our program here at the Boone County Hospital. So at least to start out, heart health in general, ways to keep your heart healthy. It's often similar to ways to prevent further disease. So we might touch on similar subjects here a little bit, but the biggest thing is between your diet and your activity and your just general health maintenance are kind of the big things for maintaining a healthy heart. When we say eat a heart healthy diet, that generally means thinking about things that are low in saturated fats, low in salt or no salt, low cholesterol diet, low sugars, and try not to eat a lot of processed foods. Trying to make sure we're eating healthy fats like nuts and legumes and getting an adequate lean protein source, and lots of fresh or frozen fruits and vegetables. Trying to avoid canned things if at all possible, or really reading those labels and making sure that the sodium levels are non-existent or as low as they can be. The big thing about any of the changes that we talk about or any of the healthy habits that we talk about is not to try to get overwhelmed with all of them. Just making one small change at a time is important, to let them become a habit slowly but surely over time. I think that Emily and I were looking online the other day about how long it takes for a habit to come into place. And I think it was
66 days.
2 months, almost like over 2 months. So you really have to stick with something for a long time to make it a habit. Another big thing other than eating healthy is exercise to the best of your ability, or just being active as many days out of the week as possible. We follow the American Heart Association recommendations of 30 minutes to an hour of some sort of heart pumping activity is what's going to be best for your heart. Obviously, you can be active and good for your muscles and joints, but if we're talking about heart health specifically, getting that heart muscle beating at an appropriate level, appropriate rate, is what's really going to help your heart out the most. Another big thing is trying to get good quality rest and practice good sleep hygiene. That's something that I think a lot of people struggle with, putting your phone down and not looking at it for an hour before bedtime, finding ways to wind down at the end of the day, not drinking a lot of caffeine or having a lot of sugar or chocolate or anything like that right before bed, not being incredibly active before bed, and just trying to think of ways to make your bedroom as calming of a space as possible can help with rest. And also wearing any machines that you may have prescribed to you, like a CPAP or a BiPAP. It's all super important with getting good rest, and that's good for your heart. Another thing is stress management. We want people to develop good, healthy coping mechanisms. So when I say healthy coping mechanisms, I mean getting that good exercise, or finding meditation or yoga or deep breathing, trying to avoid kind of those vices like alcohol and drugs and tobacco, things that you can fall back on at some point if it's a thing that you've done in the past. But finding those healthy coping mechanisms is really important. I kind of already touched on that, but avoiding alcohol and trying to stop smoking, nicotine, drugs, those are really harmful for your heart, in excess and at all. Nicotine is horrible for your heart. And then just in general, being aware of the signs and symptoms of a heart attack. You know your body better than anybody else. And so it's always good to pay attention to something that just doesn't feel right or is off a little bit, especially because men and women can have different presenting symptoms with heart attacks and cardiac disease. But kind of the general things that people think about are that chest pain and pressure, like an elephant sitting on your chest, not feeling like you're able to catch your breath or get a deep breath, feeling like abnormally fatigued or tired, sweating, vomiting, having a nauseous feeling in your stomach, any pains that might radiate from your chest out to your arms or your jaw, sometimes to your back as well. But like I said, you know your body best. And if there's something that just doesn't feel right, it's always good to I know, give a call into your primary care provider, go stop in at the walk-in clinic, go to the ER if you think that you're having something like that happen. It's never a bad thing to get checked out and just to make sure that you're fine. And then the other thing that I was going to talk about was like hereditary stuff and genetics and things like that, which is something that we call a non-modifiable risk factor for heart disease. We talk in terms of things that you can change and things that you can't change to keep your heart healthy. And one of the things that you can't change is your genes and your family history. So if you have any close blood relatives, and when I say close blood relatives, I'm talking about parents, siblings, more likely than not, sometimes grandparents. If they've had heart disease, your chances of developing heart disease is higher. There's another portion to that we've learned about called familial hypercholesterolemia, which is just high levels of cholesterol in your blood and in your body. And those people that have that familial portion and that genetic disturbance that is making it higher in them than in other people, usually diet and exercise aren't enough. And those are the people that have to get on medications before diet and exercise will do very much for them as far as lowering those unhealthy levels of cholesterol in the blood. Just always like a few statistics thrown in there that 1 in 4 male deaths are cardiac related and 1 in 5 female deaths are cardiac related. So very prevalent, and I believe one of the number one killers of our population is heart disease, and sometimes can be a silent killer too, because people don't realize what's happening or if they're having a heart attack. And people that have had cardiac issues in the past are more likely to have more of them in the future, especially if they don't make any changes. And I think that Emily's going to talk a little bit about that also.
Yeah. Another aspect of our topics, or of our topic that we wanted to shed some light on, is prevention. As Kendall mentioned before, part of prevention is making those diet changes and exercise changes. However, it takes a while for a change to become a true habit. So when we were looking into some things, about 2 months. So if I made my mind up to start exercising 30 minutes every day today, it would be 2 months before that's a habit. So you really have to kind of give yourself some grace and not be as hard on yourself, but really try to maintain those changes that you want to keep a healthy heart. Yearly physicals and preventative measures and testing with your primary care provider are always recommended. A lot of times I feel like they just do some preventative blood work. Take a look at that, make sure all of your labs are looking great. If you have any continuous problems, that's a really good time to bring it up. And then there's other tests that they can do, and sometimes you might not realize it, but something will be detected. And then here at the hospital, they do offer wellness labs. They are a self-pay program, so you don't necessarily have to have that doctor to sign off on it. You just go to patient reg and ask them how you can get set up with the wellness labs. They are like a self-pay option. So from when we were looking, some of them can be $10, upwards of $50, I'm sure, maybe higher. I don't know if it's been updated recently. And then to shed some light on the maintenance for your heart health, Kendall talked about non-modifiable risk factors, so I'm going to talk about the ones that we can change. And a big one that we can change is, surprisingly enough, your blood pressure. If you have high blood pressure, it is very important that you get that treated. If you don't, it can lead to more severe things. A healthy blood pressure is considered, it can be 130/80, but they prefer it to be less than that. 130/80 is considered borderline for high blood pressure. And if it's higher with activity, that's more okay, but at rest, we really want it closer to that 120/80. Keeping those cholesterol levels within range. So if you get your cholesterol drawn and your doctor tells you it's high or it's starting to trend up, make sure you're doing diet and exercise. If they recommend that you take medications, we highly suggest that you follow up with that and take your medications as directed and continue taking them. The cholesterol is what builds up in your vascular system, and that is what causes heart attacks. And it can lead to other health issues down the road. So yeah, stay on top of your cholesterol levels. A big portion of that is going to be those diet changes, staying away from salts, staying away from the unhealthy fats and saturated fats or trans fats. Stress management. If you're stressed, your blood pressure is going to be higher, your heart's going to be working harder. Really trying to maintain a lower level of stress or knowing how to calm yourself down when you are really stressed. It's going to be really good for your heart. If you have diabetes, getting that, like keeping track with that, being managed, take your meds like you're supposed to, watch your blood sugars, all of that good stuff. A lot of people that have heart disease tend to have diabetes, or it can go either way. It's a correlation that has been found throughout studies. Like Kendall mentioned before, stopping smoking, tobacco use, alcohol, drugs, all of that. It's not good for your whole body. It's really not good for your heart and your lungs. A sedentary lifestyle, even if you can, I think one of the ladies before talked about even walking every day. If you can just get out and walk when it's nice out, that's better than having more of that sedentary lifestyle and not getting that movement and increasing your heart rate. And then obesity and metabolic syndrome, they can be like kind of precursors to heart disease. Metabolic syndrome really goes in with having a combination of chronic health conditions. Could be a combination of high blood pressure, high cholesterol, high blood sugar, and diabetes, and an increased amount of body fat within the midsection. It does increase your risk of heart attack, stroke, and diabetes. So trying to eliminate some of those risk factors would be really favorable. And we really try to educate our patients through the program on ways they can make those changes and easing yourself into all of it instead of going home, throwing away everything in your cupboards and starting over. And
You're muted, Brandon.
Okay, you hear me now? So exercise I was going to talk about doing the big thing with exercise is it limits risk factors. Basically everything Emily just talked about, exercise has been shown to limit that. There's even been studies shown that exercise can help stop smoking. Obviously you're being more active, so you're less sedentary. Generally with exercise, you tend to lose some weight, especially if you've been sedentary. It helps clean out all those blood vessels and things like that. So helps with the cholesterol and everything. It's also a good healthy way to limit stress. So lots of good things with exercise. A lot of our patients come in and they just don't know where to start. So the big thing with that is just find what you like to do. That's the biggest thing we tell everyone. We've had a lot of patients come in and they're just scared because they don't know what they're going to do. They think, we're going to run them on the treadmill. And ultimately what we want to do for our patients is find what they like to do. A lot of our patients are 60, 70, we've had some in the mid 90s in our program. So what we try to do is kind of change it for each person, but it's finding what you like to do. I personally don't like running, so I wouldn't expect anyone to run if they didn't want to. A lot of our patients like to walk because you don't need really any equipment for it. Especially when it's nice out. you can really just get out and do that for free. So ultimately, it's just exploring your options, finding what you like to do. The other thing with starting is start slow. Don't jump on the treadmill and decide I'm going to go run for 3 hours and find that little starting place. Maybe try to walk for 20 minutes, 15 minutes. Ease yourself into it, and then gradually increase yourself. Kind of like they were saying with the heart attack symptoms, it's just knowing what your body. You don't want to be too worn out. If you get worn out, you're not going to likely continue with continue with your exercise. So trying to make it part of that routine and keeping yourself from basically wearing yourself out, so you still have energy to do your other tasks throughout your day. Other aspect would be stretching. A lot of people they don't think stretching's worth anything, but when you're doing exercise, it's worth keeping those muscles loose. It helps prevent injury. It also helps with mobility. As you get older, a lot of our patients also tend to not move as well. Joints get stiff. So generally, that can help keep things limber. Let's see. Different types of exercise are something to note. The aerobic exercise, as it's called, is the general walking, riding your bike, swimming, jogging, things like that. Those are the things that are going to be really good for your heart. They work your heart muscle. They get your breathing rates up a little bit, but they don't burn a lot of energy. So they're generally those things take longer. Whereas if you're doing something like sprinting, you can only do that for a short duration. So doing that aerobic exercise really helps build that heart endurance, and it prevents injury to that heart in the future. That to be said, there's some people who really like anaerobic exercise. It's just you can't go as long. You have to do short bursts. They also call that HIIT training, high intensity interval training. Has also shown some benefits to the heart health. You just have to be more careful. Essentially, it's doing short bursts of high intensity energy, and then so just being careful, knowing your body, knowing when something's hurting. Don't push through it. That generally means something's not working well. So trying to modify or change things to make that exercise work well for you. Another thing is strength exercises. Strength exercises don't have to be anything crazy. You don't have to be going to the gym and lifting 300 pounds on the bench press or whatever people want to do. It's 5-pound weights you can do at home, especially for older people who maybe lose some muscle mass as they age. Those things help build those muscles, and that building those muscles help keep keep your other tasks from getting too difficult. So having some bicep muscles helps keep you picking things up easier, making so you're not getting worn out doing your simple everyday tasks as fast. Yeah. So, and like Kendall said, 30 minutes of aerobic exercise a day for at least 5 days a week is what's recommended by the American Heart Association. And combined with 2 to 3 days of strength exercising. And then I would recommend everyday stretching a little bit. A lot of people like to wake up in the morning and stretch. It helps get them through the day. And then stretching after your exercise can also help loosen those muscles up and prevent soreness. So next thing I have here is the just a little overview of our cardiac rehab program. Biggest thing is it's prescribed by a doctor. After your heart event, your doctor sends it can be your surgeon, it can be your primary doctor, it can be all sorts of different people that will send us a diagnosis. But General diagnoses are heart attack, stent placements, valve repairs, and we've even had like heart transplants. I think those are the big ones we see a lot of. So generally everything's changed, or with the exercise portion, everything is individualized. You know, we obviously some open heart surgeries, they have a lot of restrictions with the chest. So we have, we keep things, we have some limitations with that, and we try to adjust things for each person. You know, some people, especially some of the, like the older patients, they don't walk as well as they used to, so we might not put them on the treadmill. So generally exercise looks like either some combination of either walking or on the treadmill. We try to walk everyone if they're able, just because you have to walk to your doctor's appointments, you have to go to the grocery store. So getting that walking, getting those muscles strong for the walking is very beneficial. And then we also do what's called a new step, which is a seated elliptical. It kind of looks like a recumbent bicycle. And then it has arm movements and feet movements. And we also have a bicycle and just an arm ergonomer, which is basically a bicycle for your arms. So we do all sorts of variations of that. And we also have free weights and things that we do with some patients. A lot of patients come in and they're like, well, I feel so weak. I've been in the hospital for several days. You know, I've had all these problems. So it's helped building some of those muscles up and helping getting them back to doing what they like to do. Let's see. And then the other aspect of cardiac rehab is education. So we have a lot of education classes. I teach an exercise class that goes over a lot of what I've already just talked about, plus some other safety aspects for heart specific diagnosis and stuff. We also have a pharmacist who comes down and talks medicines with our patients. Kind of, we give Sandra. Sandra's our pharmacist name here in the hospital. We give her a list of their meds, and she goes through them with them and answers any questions they have. And she's a great resource for everyone in the community. You know, you can talk to your local pharmacist about any med questions and things. We also have a dietitian who helps with our nutrition classes, and also our she does some diabetes consulting. And then we also have, obviously we talk about all the different diagnoses and things of these patients. They what they went through in the hospital. A lot of the times in the hospital, they just don't understand what happened. There's a lot of things happening at once. You know, it's hard to remember everything the doctor throws at you while you're sitting in the hospital bed. So we kind of go over that stuff with them and tell them how to, and then obviously the prevention that we already went through, talk about little ways to change their habits and things to help prevent them from coming back. Let's see. Another aspect that I think is a little underrated, or is not, yeah, you get what I mean. The social aspect. A lot of these, especially the older ones who aren't mobile as well, they don't get out much. They get all these people who also went through these things. You know, a lot of time in our waiting room, we hear, oh, you had a heart attack too. So did I. Where were you at the hospital? Who's your doctor? How do you like them? You know, what meds are you on? I don't like this one, but they tell me I have to be on it. So it's really great for a lot of these people who can't get out much. Maybe the only people they really talk to a lot are their kids or their spouse, you know. And then, you know, that a lot of times keep people coming back. You know, we have a phase 3 program, which is basically a maintenance program or gym membership. They come in 2 to 3 days a week. They kind of are led on their own. We're not as hands-on with them. We still monitor heart rates and blood pressures and stuff like that. So, you know, they're still monitored a little bit, but we're not as hands-on with them, and a lot of times they just come in to chit chat and have a good time, and oh, how are your kids? So that's always a great thing, and that's self-paid. Fortunately, insurance doesn't cover it, but it's relatively cheap. It's $7 a session. We encourage anyone who is in the program to continue, especially when they don't have things at home. So let's see. Oh, I forgot to mention that our phase 2 program, which is right out of the hospital, that is covered by insurance. Pretty much all insurances cover it, whatever. We always confirm with the insurance, make sure that you don't have a copay or anything like that. And if you do, that way you're aware of it beforehand. We try to be upfront with that knowledge, because if you're coming 3 days a week, that copay can add up sometimes. So we want to make sure that you're aware of those things and you're still willing to come, hopefully. And yes, I think that's most of what I have here. So
That's awesome. Thank you so much, Brandon. It was so funny because I was writing down notes and writing down questions, and then you kept filling in my blanks. So you did a great job of helping answer a lot of questions I had along the way, and even all the way down to the social connection, because I was like, well, with Valentine's Day, that's the other part of heart health too. You touched on, the three of you together touched on lifestyle medicine. You talked about each area, which is the nutrition, movement, sleep, risky substances, stress, and then I had written connection down to talk about it, and then you even brought that up too. So yeah, it is an important part of it, and it is a great place. I've always heard that all the years that I've worked here, all the people that come in and have that great connection, with the staff there and with each other when they come into cardiac rehab. We just had a question pop up on chat, which was actually one of my questions, which was, and you kind of touched on this in terms of having like specified workouts for people, and so you're going to have a heart rate monitoring. You were talking about that. Can you tell us just a little bit more about like how you calculate that? And it doesn't have to be like the exact calculation, but how you calculate that for a person, and like what you're looking for in a max heart rate or a low heart rate.
So the big thing with the heart rate is there is a calculation, but I would say that probably a better way to do it when you're at home, and you maybe not have all the equipment to check your heart rate very well, or if you don't know how to check your heart rate. A big thing we always tell people is, if you can talk, it's called the talk test. If you can talk, walk and talk, or do whatever your exercise is and still kind of chit chat, you're probably not overworking. If you get to the point where you're having trouble, like really holding a conversation while you're exercising, that's a good way to do it while you're at home. If you're looking for an actual number, what we use is very dependent on the person. It's a calculation based on your age. So obviously 20-year-olds target heart rate is going to be much higher than a 80-year-olds. So generally it might not be super feasible for people at home. But the talk test is another great way to kind of gauge how hard you're working. And another way I would say is, after you're done exercising, if you feel very fatigued and you're not recovering, if you're fatigued for a long period of time, if you're tired for probably the rest of the day, that's probably a sign that you overworked. Your heart rate might have been working too hard. So, maybe the next time you don't quite work that hard and adjust that way. Hope that answered that.
I think that was very helpful. And like you said, it is really age and individual appropriate according to what they're, where they're starting from and what their lifestyle is, I would imagine too. I mean, if somebody comes in who's had a heart attack and was a marathon runner, that what they're going to have is going to potentially be a little bit different maybe than somebody who is sedentary and had a heart attack. Is that correct?
Yeah, and everyone's heart rates are different on their own.
Mm-hmm.
me and Emily are very similar age. If our heart rates aren't the same, I guarantee at rest, so everyone's a little bit different. Generally, if you're more overweight, your heart rates can be higher. If you are a long distance endurance runner, your heart rates tend to be lower. It's a lot about how strong your heart is as well, and how efficient things are. Everything, a lot of little things attribute to your heart rate, and so yeah, there's no clear like 100's a bad number. It's not. It's very dependent on the person. So
Sure, sure.
I was also going to throw in there too, Sarah, that different medications can lower your heart rate quite a bit. So any of our patients that are in here and they're on something called a beta blocker or an ACE inhibitor, we're going to see them with just lower heart rates in general. And so oftentimes we can't gauge how hard they're working based on their heart rate. They have to tell us. And like Brandon said, using the talk test or our rating of perceived exertion is a good way for us to do that.
And on the opposite side of what Kendall just said, we also have some patients in here that for one reason or another are on medications that increase your heart rate. I feel like a lot of the transplant medications they tend to increase heart rates. So it's kind of same basis, but opposite way. If your resting heart rate is close to 100, you're just going to have a higher heart rate, and we try not to overwork your heart even when your resting heart rate's already higher.
Great, thank you for those additions. So the other question too is, do you have to have a qualifying event for cardiac rehab? I think you mentioned heart attack stents. I think there was something else too, I don't remember, but is there something specific that people need to know around that? Oh, and valves. So it was kind of the three that were mentioned.
Yeah, so we're largely governed by, we say, Medicare guidelines here for making sure that your event qualifies for insurance coverage. So those qualifying events would include a heart attack, any angiogram and stenting procedures, bypass surgery, any valve replacements in the heart. If you have congestive heart failure, that's also a qualifying diagnosis, but only if something called your ejection fraction is low enough. It has to be below 35%. And that's just a marker of how well your heart is squeezing. And they check that with something called an echocardiogram. So if you've ever had an echocardiogram and you have heart failure, you might know that number, or your primary care or your cardiologist would know that number. And then am I forgetting something? Oh, unstable angina is another one, which would be unstable chest pain. If taking medication and resting does not alleviate that, then that is another potential qualifying diagnosis to come in for our phase 2 program in cardiac rehab.
And then our phase 3 program, it's not sent to insurance, so we don't have those strong of guidelines. So even if the phase 3 or maintenance, if you're at risk for having a cardiac event or having another cardiac event, and you want to come exercise, by all means, we do encourage it. And we just send a paper over to your primary care, your cardiologist, saying, this patient wants to exercise. These are our kind of rules for their exercise, and this is what is pertinent in their health history that tells us that they could benefit from this continuous exercise program.
Great. That was very, very helpful, you three. And I just am so grateful that we had the opportunity to talk with you today and learn more about, all the things related to. You just did such an awesome job of really going through thoroughly from prevention all the way to that phase 3 of talking about maintenance, and just really touching on all the different areas that people can maybe benefit, not maybe, will benefit from cardiac rehab. So my last question for you is just, if somebody has, obviously they have to be referred to you. So, but if they have questions or anything, is it okay for people to reach out to your department and talk to you if they have questions or they feel like they should maybe go talk to a heart doctor, they're wondering if they should. I mean, what's the option? What are the options there?
Absolutely. They can always call us here at the hospital at our department and ask questions if the doctor that is trying to refer them has questions. They can call us too. We can fax them the paperwork that we need for that qualifying diagnosis, or like Emily said, if they have those risk factors for a heart disease or an event and they're just curious if they could come in for that phase 3 program, that self-pay program, to work out with us and benefit their heart. Yep, just give us a call because we're here and we can answer questions.
Do you mind, just for the recording, going ahead and saying what that phone number is?
Yeah, so in cardiac rehab, our phone number is 515-433-8120.
Great, thank you for that. Any parting thoughts before we sign off today?
Nope, just a happy Valentine's Day and take care of your heart like you take care of your loved ones. And hi, Mom and Dad.
That's great. I love it. Well, thanks again so much for all of your expertise, your wisdom, and being here today to share the knowledge and information you have with all of us. So thank you again. Take care. Everybody have a great Heart Month and hopefully go outside and enjoy the sunshine today in February, which is amazing. Take care, everybody. Thanks
Thank
for being
you.
here. Bye.